My mom once told me, if you're early, you're on time. If you're on time, you're late. And if you're late, don't show. So we're going to go ahead and get started right on time. Thank you all for joining us today. My name is Joshua Scott. I am the Director of Education here at the Center for Health, Work, and Environment. Also in the room with me is Michelle Hahn.
Hey everybody, I'm the Community Programs and Events Manager for Healthlinks.
So again, thanks for joining us. We have folks from all over the country today representing different centers of excellence around total worker health affiliates, small business owners, operators, and we have some government folks with us today as well. So we have a very diverse audience, and when you have an audience like that, you have very diverse needs. So just to kind of set the tone for today's presentation, Healthlinks works across the state of Colorado with small businesses primarily. So that would be, ranging anywhere from employee having 2 employees all the way up to 500. And we do work with some larger organizations, but this data series and specifically this presentation was developed really with the small business in mind. So if you're putting your hat as the engaged learner on right now, I want you to put your hat on as somebody who either is in a small business, who works for a small business, is a small business kind of owner, operator, or human resource manager, something like that. And I think it'll have a little bit better relevance to you wearing that hat today. Some of the information will seem new and some will seem pretty basic, but that's because this presentation was developed based on the questions that we field most frequently around developing a really basic needs and interest survey from the Healthlinks perspective. So that's how we developed the presentation for today, and I hope you enjoy it. So without further ado, we'll get into some housekeeping. All participants are going to be kept on mute throughout the presentation. However, there is a chat feature, and you're able to submit your questions or comments over using the chat feature on Zoom. And just to test it out, to make sure you're all paying attention, as many of you know, I see a lot of familiar names on the participant list. I am a relatively new dad, and so I figured I would test out my new dad joke-telling skills with using this chat feature. So I'm going to tell you a joke, and I want you to try to answer it or submit just a question mark in that chat feature. So the joke is, let me see if I can get this right. Why do ships in Finland have barcodes? You can submit your answers via the chat feature.
Lots of question marks coming in.
Lots of questions, come on.
Somebody has to try. Why?
Thanks, Madison. I do not know why. All right, so the answer is, so you can Scandinavian.
Oh my gosh.
All right, sorry. Yep, I know that was the epitome of dad joke, but it seems like, yeah. Thank you, Shauna. Ouch is right. So yeah, I just wanted to make sure the chat feature was working, and I will not be doing stand-up anytime soon. Also, just to let you know, this webinar is being recorded, and we'll share the link with everyone afterwards. We want to make these resources available to everyone, especially the small businesses that we help. And then finally, after the presentation, a survey will pop up, and we really appreciate your feedback. So it shouldn't take more than 2 minutes. And it's fitting since this presentation is on needs and interest survey development. So yeah, hopefully you're not too fatigued afterwards. You can see my face, so there you go. I am less pixelated in real life. But I'm the Director of Education and Training here, and I've worked with many of you. And just to kind of preface this, I do work with data on a regular basis. And I work with a variety of data, but there are also other people in our group and other people who will be continuing on in this series who work with data on a kind of day in, day out, and on a very more complex basis than I do. So that's why I'm taking the first one, because I think it's probably the most simple. And also, I do love and need data. So for those that have worked with Healthlinks before, you know that we have 6 basic benchmarks that we assess businesses on, and it's really kind of an inventory of what they're doing around some basic total worker health principles. And one of those is worksite assessments. So just to let you know, that's where this conversation fits in today among the Healthlinks benchmarks. And just as a summary, I always like to provide this first so that you know what I'm hoping. You know, at the end, if you take nothing else away, it's this. It's that integrating and aligning workplace assessment data informs program goal setting, planning, implementation, and evaluation metrics. Workplace needs are the hard and fast objective workplace data that define the must-dos. Workplace interests are the subjective pieces of information that customize programming to meet employees where they are. So that's kind of just remember that, and I'll have done my job today. So the big questions we're trying to answer is, what is the difference between needs and interests, and how do we use that information? What are some existing sources of data that small businesses may already be collecting that they can use, and what role can Healthlinks play? So just to define, what do we mean when we're talking about workplace assessments? They're the mechanisms that we use to gather employee, organization, and even potentially environmental data. That information helps us do a couple really key things. It helps us drive program development and kind of adjust programs over time so that they remain meaningful and relevant. One of the things that I like about survey data specifically, and especially with small businesses, is that small businesses may not have access to a lot of maybe employee health information, healthcare utilization information, and if they're under 50 employees, under 20 employees, they might not even have access to some basic safety information. And so I really like to use surveys is because they can give us a pulse and not necessarily give us these really lagging indicators. So, if you're looking at potentially a modification rate for workers' compensation coverage, the mod rate, that's very much a lagging indicator. That's not going to change for a long time if you have a progressively safer workforce. Whereas you can get real-time information from surveys, which is what I think is the most exciting and the most meaningful. But hopefully, with the information that we do collect through surveys, that we can use it to make real-time adjustments to our program or to build programming in a meaningful way that directly addresses what people are looking for and what's going to have a big impact in their lives. So some basic types of survey information. So assessments can really be formal or informal data, but in our world, and this is kind of how we break it down for Healthlinks, is they can be broken up into 2 big buckets. We can have kind of the data that helps inform employees' interest and motivation around health and safety. So it's the data that helps define what employees think and how they feel, what kind of wellness topics they like, what incentives would be meaningful to them, what barriers they may have to participation, things like that. So I mean, that's kind of one big bucket for me. And then the other one is needs, and this is the data, like I said in the beginning in that summary, that really defines the hard and fast information. It's not really subjective. It's objective information. It might be information about employees' health status that you get from doing health screenings. It might be healthcare utilization information. It might be OSHA 300 logs. It might be environmental assessments at the workplace. I mean, this can be really hard and fast objective data, not subjective, more on the interest and motivation side of things. And this just gives kind of a high-level flowchart overview of when we do an employee survey, especially for the first time with an organization, where we start and where we hope to end up at. So we kind of start out by saying, what is the mission, vision, and the goals and objectives, both of completing or of doing a survey, but also of your organization. You have to make sure that collecting this information and doing something about it aligns with the mission and vision of the organization. Then we look at what sort of needs and kind of other interest, motivation kind of information we might look at collecting. So information around job hazards, environmental hazards, workplace accidents and injuries, absenteeism, maybe health risk or health screenings, employee culture, employee interest, motivation barriers. These are all, we kind of decide what areas do we want to do that align with that. And then we develop, we distribute, we analyze, and we convey that information back to the people who supplied it to us, which is oftentimes a misstep. So this is kind of the overall flow chart of what I think of when developing a really basic employee survey, needs and interest survey. So let's just dive right into it. We try to make this as applicable as possible. So if you're joining us, you were emailed this worksheet. I'm actually going to kind of slide back and forth between the worksheet, and so that way we can look at some of the questions, we can look at some of the processes together. But if you have this worksheet, go ahead and bring it up now. So the first step is that you really want to define the purpose. And what I mean by that is that the purpose, why are you actually gathering this information? Do you want to track kind of change in attitude? Do you want to track change in behavior? Are you looking at gathering information about people's kind of interest and what they want? Are you gathering kind of what stage of readiness or what is their level of motivation? So it's really important to define the purpose. Why am I doing this? That can really help narrow it. I mean, the number of questions that you can potentially ask in a survey like this is just kind of endless. So starting out with why are you doing it can really help kind of narrow it down to start. And then the second piece is, how do you intend to use the information you gather? Are you looking to inform new policy development? If you're a really small business, that might not play into it at all. Or are you looking to assess or customize wellness and safety programs? So either new program development, assess current program development, or change programming over time. We've worked with companies that are really gathering it to motivate leadership, so they don't have any sense of where their employees are at kind of on a spectrum of what they want and need, and so they use it to inform and motivate leadership to take action. So really helping define that purpose is important. And then finally, after you kind of said why you're looking at it, then you can go back and say, how does the purpose of your survey align with your mission, vision, and goals of the organization? And you should be able to pretty clearly and concisely say, all right, in our mission, vision, in goals, we value employees, we value retention, we value high quality recruitment. And so, whatever those vision and goals may be, you want to be able to link your survey in some meaningful way back to that. Number two, step two, is you want to choose a platform. Okay, so to me, this is a step where I see a lot of organizations either A, overthinking it, or B, underthinking it. So there's some questions you want to ask yourself is, who is your audience? Are you trying to reach your entire work population? Are you trying to reach just a subset of your work population? It's important to understand, where is your audience? Do they all work from one location? Or do you have remote employees? Do you have employees who speak multiple languages? Or that maybe where English isn't their second language? Do you have employees that might not have access to a computer? Things like that. So, you really want to dial in who is your audience, where is your audience? And then finally, what mechanisms do you or your organization already have that currently reaches your audience? So, what Michelle and I see quite a bit is that people want to reinvent the wheel when it comes to this. So, for example, they really want to do an electronic survey, maybe because it's easier to analyze for them, or they can use something that may already currently exist, but they have an organization or they have a population that everyone gets together, once a month, and people don't typically respond to email that much, or they don't have access to email that much, or it's not a great way to engage their people they've found in the past. So, you might decide that doing a paper survey is better than choosing kind of an online platform for distributing it. So really knowing what kind of mechanisms you have. The other piece of that is you may already have a mechanism like a newsletter, for example, that already goes out, and it would be a good place to distribute that information. So whether it's a newsletter, or maybe it's a suggestion box, or by the water cooler, or things like that. So it's just really important to know your audience. And then finally, kind of deciding, do you want this to be more formal or informal? And then obviously going from there, paper, electronic, or both. Most of the time, for small to medium-sized organizations, if you want to get really high participation, you have to do both. Just doing an electronic survey is usually going to limit some of your response rates. And then, so, I just highlighted here some of the platforms that we've used in the past. I'd say more than that, and all these platforms have free versions, whether you're using Google Forms, SurveyMonkey, or Qualtrics. There are obviously additional features if you use the paid version. It might be the number of surveys you can distribute, or the number of responses you can get, or certain analysis features, etc. But we've used all these in the past, and for a basic survey, they all seem to work pretty well. We'd be remiss not to talk about survey fatigue because, especially for the small to mid-sized business, a lot of people are going through this right now. Survey fatigue happens for a couple of reasons. We find that it happens because people they've either been sent too many surveys, or they've not found meaning in the surveys they have contributed to. So I know, for me, I'm sent a survey, probably once a week, if not more frequently. And rarely do I actually know how that survey information is being used, or are people conveying the results of that survey back to me. So, typically, unless it's an organization that's met one of those two criteria, I'm probably not going to engage in the survey. So, really paying attention to survey fatigue. And also, the other type of survey fatigue is the actual fatigue that takes place while people are taking a survey. So, if people design questions that are seemingly irrelevant to people, too redundant, or the survey is just simply too long, then you'll see a pretty big dropout rate from folks who have started the survey versus folks who have completed the survey. So just some tips for reducing survey fatigue. Don't overuse your audience. So be very strategic about when you actually are soliciting their feedback. Integrate similar surveys. So if you already distribute a handful of surveys, or HR distributes, or the communications team distributes a handful of surveys, see if you might be able to just tack a few questions on to something that they already distribute. It's really important to convey the survey's value. And one of the ways that you may do that is you may choose to incentivize participating in the survey. We're not going to, incentives are a presentation for a different day, and sometimes a sensitive topic for folks. But, if you're just simply trying to engage somebody to do a single one-time act, then especially a meaningful incentive to somebody can be a great way to get their participation. You want to make it easy for them to engage. So for example, if they have to have multiple clicks, or if there's a broken link, or if the email that they receive is too long, those are all going to be kind of not easy ways for them to engage. And then finally, you want to make sure you consider your respondents. And I think, I'd like to do maybe a webinar on this specific piece of it at a different time, because I think oftentimes as people who develop surveys, we don't actually empathize with the folks who are completing surveys. As researchers, sometimes we develop these things of like, how can I make this inclusive to all the things that I want to know? And then you develop these surveys that when somebody actually takes it, they feel really disenfranchised from the folks who are administering and delivering the survey. So really consider what the experience of your respondents are going to be like when they're taking the survey. Step 3, you want to build or design and build your survey. So, you've already kind of looked at the purpose, you connected to your mission vision, you've chosen your platform. Now it's really time to choose your questions and build your survey. So if my reference is outdated for some folks on the line, this is a reference to Indiana Jones and the Last Crusade, when he drank the cup that he was supposed to choose, or else he was going to decay into oldness. So now is a good time to actually switch over to the worksheet that I gave you. So we included, starting on page 3, just a whole bunch of sample questions. And I'm going to, relatively quickly go through these just so you can get kind of a feel for some of the questions that you may ask and what some of the categories you may ask are. So I actually had a group I worked with years ago, and they did not have much support for issuing a survey, but they wanted to do something. So they asked one question, they tagged it onto another survey, and they said, do you think your organization cares about your health? If you were more concerned about safety, you could say, do you think an organization cares about your safety, your well-being? You could word this a variety of ways. And then they used how people responded to this question as a way to motivate their leadership. So they said, their initial response back was basically, something like less than 10% actually answered yes to this. And we actually had it stratified as a 5-part potential response. So, but only about 5 to 7% actually answered yes, and a majority of people answered somewhere in the middle or definitely no. And so they used this as the sole measure for about a year and a half to say, do people think that we care? And after about a year and a half, over 75% of people had answered yes, and so they felt like that was the only measure they needed to make sure to assure that they're moving in the right direction. But we know that for many organizations, they're going to ask a lot more questions than that. So you can ask some basic kind of health status questions. These are really basic, and with a lot of these kind of health risk assessment or health status questions, there are a bunch of free resources that exist online, or your workers' compensation provider or your healthcare provider will have an HRA that you can use that will aggregate the information for you. You have to be very sensitive when you're asking individual health information to make sure that you have enough kind of employees that you're not getting any, you can't identify any individuals by the way they respond. So that's just an important consideration to make here. But you can ask some basic questions around, do you know your health status in the following areas? Yes, no, or don't know. Have you consulted a doctor about these areas? How do you feel about your health in these areas? Positive, negative, unsure, need more information. So this is really, really basic, but without access to an HRA, this is kind of high-level information about health status that you can ask. You can ask a variety of questions about safety concerns if you want to include safety in it. So, do you experience any workplace safety hazards that have the potential to cause work-related injury? Do you feel your organization is adequately addressing those hazards? Do you feel like your managers or supervisors support workplace safety? What could your managers or supervisors do better to promote it? There's a lot of wellness programming data. I'm actually going to pause here for a second.
Yeah. I had a question for you. So for those sensitive questions, how do you recommend that small organizations, say with less than 10 individuals, answer those questions? They're really important to how you would improve your workplace culture, but an employee may not want to answer those based on not being able to be anonymous. So do you have recommendations on how to gather that feedback for really, really small organizations?
So typically in small organizations, let's just choose that question, 10 or less. And we may get into this more later. There's not really a good concrete answer for that. Employee anonymity is really important. And when you have 10 or less employees, asking questions around their current health status can be really tricky. What I typically like to focus on is more than the wellness programming area. So really gathering information about what people are interested in rather than their health status. The other way you can do it, I know in a lot of the small organizations that we work with, it's such a close, intimate environment that rather than going the survey route, they actually integrate it into their kind of annual or biannual evaluation. So during their evaluation, they'll say, hey, I've known you for years. Do you have any health things you want me to know about that may be affecting your work. I'm here to support you in any way, and just know that we're here to help. And so they kind of address it during kind of those formalized periods in a very approachable way. But if that doesn't fit your organization, I know that may be intimidating for some folks. So if that doesn't fit your organization, then I would just typically focus on the wellness programming aspects and not ask health screening information. Yeah, I know in our world we tend to be more risk averse, and so that's kind of a good approach to take, I think. So you can ask some basic, wellness programming information around what do you want and need, and this is where some of the questions can get really long. So around health screening, so it said, if our organization were to offer these things, how likely would you be to participate? And you have see a variety of health screening options, educational programming options, and kind of the options are really endless. These are just examples of what you could include. Fitness programming options, employee assistance options or EAP options. If your workplace were to offer programs in the areas you integrated above, how likely would you be to attend those programs? So, sometimes we see some inconsistencies here. So they might say that they're really interested in something, but that they might not be super likely to attend. And usually it's because of some of the barriers, and that, you can kind of look at those later. So how likely would you be to participate if we were to offer incentives? And then which of the following incentives would be most meaningful? And oftentimes you want to make sure that you're only offering, or you only include incentives in this list that your organization is willing to and can provide. We find it to be a common mistake that organizations ask an open-ended question here, and then oftentimes really can't do anything with the information that they find because there's either no consistency of response, or people are saying things that they're not willing to, or leadership hasn't committed to providing. Please indicate how likely you'd be to participate at the following time. So knowing when, if you offered something, people would participate. What barriers people may face, like it might be supervisor support, lack of time, pressure to get work done, job duties, things like that. And then I'm actually going to divert some of these leadership questions, but we find it important if organizations are willing to ask questions around family and community participation. So if we offered events that were open to your family and or community members and friends, would you try to engage them in those activities? So I don't want to spend too much time on this, but you can see there's a lot of potential questions that you can look at here. The other area, and I included a bunch of these, are kind of some general health, safety, culture questions. And these are the questions that are around leadership commitment, leadership support, people's willingness to engage in programming, people's support that they feel around the workplace, how people feel about their work or about their organization. So these are kind of the general culture questions that you can ask. And one point I did want to make. Now, by the way, I did add some demographics here, but again, I said, including these can be really tricky for small organizations. So just a caveat to that. As you saw in some of those survey questions, especially when we got to the culture questions, you saw that we were asking multiple that looked very similar to one another. This can be really tricky. The reason we do that, for those that engage a lot in survey development, this is pretty rudimentary to you, but we want to validate survey responses, and so and really assure that the way that somebody answers one question accurately portrays how they feel or think about that question. And so you might ask 2 or 3 or 5 very similar questions to assure that they're responding similarly to those. So if you're just using this as basic survey development, just asking one of those questions is really fine. If you're looking at developing a very reliable and valid survey, then you want to be able to choose multiple questions that kind of get at the same response or the same answer. Okay, moving on. So step 4, once you've chosen your questions that align with your mission, vision, value, the purpose of asking it, then you distribute and analyze it. Some of the common pitfalls that we see here are that people don't really set up a timeline for for when they're going to have certain pieces of it done, when they're going to open the survey, what their kind of plan is to get it to everyone, and then two, when they're going to close the survey. So sometimes we see people just leave it open-ended, or they keep postponing the deadline of when the survey ends, and it's just kind of this never-ending cycle, I guess. So we think it's really important to have kind of a specific stop date to your survey so that you don't keep getting kind of trailing people submitting responses. And then I put a little note here. It says don't get trapped by analysis. And what I mean by that is that for many of these organizations, they've never taken a stats class. The person who's doing the analysis or looking at the data has never taken a stats class. But really, the survey, if you're using something online, the survey tools really do everything for you at a level that's probably meaningful to the small business. So, looking at the percentages of how, or the frequencies and numbers of how people responded is usually plenty, or looking at those changes in percentage over time is usually plenty for that small business to kind of gauge their activity. And then, I put a note here as that third bullet of share meaningful results with leadership as you get them. Oftentimes, especially when people are getting kind of stuck in the analysis phase, they don't want to share any of their results until they have the analysis completely done. But especially when leadership has engaged in this activity, we find it to be a really meaningful step to, as you're getting a couple of those results in, to share them, kind of give them glimpses of the kind of the preview before you convey all of the results back. So then step 5 is plan and disseminate. So, you've just spent a bunch of time analyzing your results, and now you can use that information to change the current programming that you're doing or develop new programming that's going to meet those needs. And then, we include disseminate here also because we find that to be probably the most commonly missed step amongst small businesses. Is they use the information, they analyze it, they use it for planning, then they start their programming, but they never share the results back with the people who completed the survey of, here's how you responded, and we heard you loud and clear, here's what we're going to do about it. And we find that to be a really important engagement strategy, both one, if you want to reduce survey fatigue over time, and two, so that people feel engaged, supported in the work they're doing. They feel like they have a voice in initiatives that are being administered, that they're not just being delivered at them, that they've been a part of the process. So one of the things that I'd like to highlight in kind of this, all right, you've done the analysis in the planning phase, is that you really don't want to have the person who's doing the planning as the center point the person who did the analysis at the center point of doing the planning. You really want that to be kind of an interdisciplinary effort. I know that's a very jargony term, interdisciplinary, but what we mean by that is that you want to have a team of people from your organization. It doesn't have to be a huge team. We actually find typically that smaller teams are more effective in this, but you want them from a variety of different both expertise and kind of departments or job tasks within your organization. So you might have somebody from safety, human resources, benefits and wellness, somebody who's in a leadership role, or maybe somebody who's just kind of in a different department, so they work with a whole different group of people. You want to have somebody from an employee level who has a voice in that kind of planning process. And then part of that interdisciplinary process is really learning about what's meaningful to these other groups of people. So once you share your results, you want to find some meaningful and overlapping goals that you can sink your teeth into. So for example, if leadership says, we want to reduce the number of accidents and injuries, well, that's meaningful to leadership, it's meaningful to safety, it's meaningful to human resources, and it's really meaningful to wellness because they're going to play a significant role in potentially doing that. Or we want to reduce the amount of time somebody is absent once they get injured. Wow, man, wellness is going to have a really important role to play in that. So find some overlapping goals, find some overlapping kind of higher level metrics in the results that you found. So maybe it is hazards that people reported on, or leadership support in a given area. So set some of those metrics, and then you can kind of plan your intervention activities from there. So I already talked about leadership or disseminating broadly, but I included in the third bullet here community partners. And we actually find this to be a really good, most of the organizations who are engaging in this sort of work want to be viewed by their clients and by the community as an organization that cares about their employees and that cares about the work that they do. And so we find that at a very high level, maybe it's in an annual report, or maybe it's in just kind of a newsletter that goes out to the community, or a press release or something, to share some really high level information around this is what we're doing to support our employees. And we find that to be really valuable for some of the organizations that we work with. So that's a really high level of kind of answering some of the questions that we get around basic needs and interest survey development for small business. Now, I want to make sure that I kind of say, well, how does this fit with the Healthlinks assessment? So currently on the Healthlinks assessment, we asked, have you determined the health and safety needs of your employees? And we ask how they use that information. So, they can say, yeah, we use an employee for survey to understand the health of our employees. We use to understand kind of the safety. We use health risk assessments, physical worksite assessments, health screenings. So here are the questions that we ask on the general Healthlinks assessment, which is really kind of a general kind of survey and engagement tool for what are you doing around these activities at work. But here's how you can use that information in conjunction with a basic kind of small business employee needs and interest survey. Is you can first look at inefficiencies and barriers to participation. And what I mean by an inefficiency is, let's say on a survey, people are conveying that they want more stress management or financial planning tools and resources. And then on your Healthlinks assessment, you find, wow, we've actually checked the box here in several places that we're doing quite a bit on for stress management and for financial well-being. But for some reason, people aren't actually utilizing those resources. So that's an inconsistency between what employees expressed that they wanted, what's being offered, and what they're actually using. Then you can look into what barriers they indicated on the survey to say, wow, are some of these barriers getting in their way, and can we work to remove some of these barriers and potentially better communicate what we currently offer? So we don't have to reinvent anything. We just need to communicate better and remove some barriers to access. Number two is that you can look at areas of consistency where there is a low Healthlinks score and it's also matching a programmatic area of interest. So for example, you find that people really want more physical activity related programming, and you find that you scored low in kind of that health programming area on the Healthlinks assessment. Well, that's an easy win. To me, it's like, all right, well, let's boost some of our programming in this area and make sure that we're addressing people's barriers and needs as we go through it. And then the final step, which we'll address much more completely in the next 3 parts of this series, is looking at integrating with other forms of data. And those are some of the other forms that potentially really get at what are the needs of employees, kind of those hard and fast objective data that we can use. And so I just wanted to give you kind of a really high level, like what might that look like? And so what I put up here is, for some of our small businesses, they're like just starting to understand what is an OSHA 300 log. And I'm saying, wow, this can be a really important form of data that you can integrate with the other pieces of data that you find. So, if people are expressing certain hazards in the needs and interest survey, if they don't feel, and if you're finding that people are actually getting injured with that hazard from your OSHA 300 log, well, wow, now you have hard and fast objective data that matches what people have expressed as workplace hazards. Now you're starting to kind of integrate different forms of data. And this is just that. I just wanted to highlight what I meant by that data integration piece. All right, so wrapping it up, just some big takeaways is that formal and informal data on employee and organizational need and interest should drive goal setting and program decision making. Giving employees a voice in decision making and sharing the information they provided back to them really does work to increase engagement. Workplace needs are the hard and fast must-dos that you need to address. Workplace interests are the more subjective pieces of information that really help customize and design programming. And then finally, and we'll address this again more in later series, but integrating safety data and other forms of data is a really good step once you've done these really basic steps. We find that so many organizations want to do the right thing. We actually find that they then dive headfirst into offering all sorts of programming, and they end up floundering because employees never said that they would use it. Employees never said that they would be interested in it. They never said that it would be meaningful for them, and it's not actually linked to a need. So, for example, either a health need or a safety need, and so it's not even going to have that big of an impact if people do actually participate on the organization. So, we find that to be a really common pitfall, and that's why we started with designing a basic needs and interest survey for a small business, because it's a first step that organizations can take that can have a really big impact in the services they provide back to their employees. So for folks who are online, we have another webinar coming up. I'll take a second to answer some questions here, but I want to get through the rest of the deck. So on January 25th, we have another webinar. It's a mental health or a maternal mental health 101. Maybe I should do one on paternal mental health too after that. I was just telling Michelle that sleep is not happening much these days. If you're local to Colorado, we have an event we're doing in Grand County up in Granby in the mountains. And it's a partnership with the Chamber of Commerce, Public Health, and a variety of nonprofits. We're doing a business over breakfast and engaging employers around mental health. And then finally, we're participating in the American Heart Association event on the 14th. So in the next month, those are the ways, whether you're local or just joining us remotely, that you can engage. Some other next steps.
Well, I was going to, sorry, I keep interrupting Josh, but I was going to say, if you want to stay tuned for all of our events, if you go to our Healthlinks website, we have a new training tab, and on the right-hand side of the page, you can see all the upcoming events, register for them there, find out the locations and more information. So everything should be listed on our website, and if not, you can just email somebody on our team and we can help you out.
Yes. So also next steps, if you're not currently a Healthlinks business and you're in the state of Colorado, please contact Kaylee Rivera. We have a wonderful community here, and we work very closely with employers around assessing those 6 benchmarks that I mentioned at the beginning, and then helping them with some kind of evidence-based advice on what they can do next based on the results that we find. Also, we are doing a very big total worker health study in the state of Colorado. And so if you're a business that wants to get more leadership training, wants to get more information about assessing employee health and safety culture, and want to join that research community, we'd love for you to visit us, and we'd love your help and support. So you can either contact Kaylee, or you can just go directly to the website at ucdenver.edu/CHWE/SWELL, SSWELL. And you can always connect with us further. And what time is it, Michelle?
12:45.
12:45, perfect. I wanted to leave about 45 minutes at the end here for
15 minutes, not
45 minutes. Yeah, sorry, definitely. Yep. So questions are very welcome, and thank you so much for participating today. I look forward to hearing from people in the future. But yeah, tell us what your questions may be. I see a comment from Sabrina, which I wanted to highlight, and she just said that I also recommend asking health goals rather than health status. Again, for the small employer, it's really important to highlight it just may simply not be appropriate. And oftentimes, we put the metrics at maybe around 50 employees or less. You might want to avoid that, but it's really just kind of somewhat dependent. We've seen organizations as low as 20 or 30, but it's a very different organization. Can you give the UC Denver? So in all the follow-up communications, Michelle will just have that plastered everywhere, just so that people know. But I will put it up on the screen here. I promise I will put it up on the screen. There you go. So ucdenver.edu/CHWE/SSWELL.
Yes, and Josh, as Josh mentioned, you'll get a copy of these slides that you can share, a link to the recordings that if you want to forward it to any of your coworkers or colleagues or friends that might find this information valuable. And then the worksheet that Josh went over today will all be sent in a follow-up email, so you can download everything and have access to it for as long as you'd like.
Yeah. I also, again, just wanted to be very clear in, this wasn't meant to be an in-depth presentation on, question design, for example, and we could have a whole, hour, 2 hours, a whole class on just how you end up designing these questions. It was really meant to be an overview of the process, the value, some important missteps, and to highlight some of the big questions we end up hearing. Speak now or forever hold your peace, or I might even tell one more dad joke if I don't get another question. All right, so I'll finish this out then, Michelle, with one more dad joke.
Brace yourself.
Okay. Why do cows have hooves?
I have no idea.
Because they lack toes.
Oh.
All right. All right. So I think that concludes. Thank you for laughing, Madison. I appreciate it. That concludes our presentation for today. I really appreciate you joining us, and all this information will be sent to you afterwards. Please participate in the 2-minute question after we close out the webinar. Thank you, Suzanne, I appreciate it. All right.
Thanks, everybody.
Signing off.